look like them to get care, they won't receive it. But we need to have enough options available where individuals can come and receive care. Public health is the mainstay and the backbone of our healthcare facility. When all else fails, when there's a problem or an emergency, you call on public health. And we work behind the scenes and answer the call. But from the health department, we are definitely concerned with access to care for our citizens. We want to promote health and have every person take personal responsibility for their health. The dramatic sweeping changes that have just occurred in the Food and Drug Administration with tobacco is a direction that we have to move in this country. There has to be accountability for the delivery of products or services that can harm individuals. They have to be regulated. And I believe in the same way that each and every person has to take the primary responsibility to use the resources that they have that is in their own and their communities and their counties and their states and their country's economic benefit. If you have health insurance and you go to the emergency department to receive care, you just increase the cost of your care by at least 20-fold. And I'm not exaggerating. You have to get your blood pressure checked, get your diabetes pill refilled, get your asthma medication refilled. Some are very important. You may have to do it on an urgent notice, but you cannot plan to say, well, I'm just going to stop in the hospital at 2 o'clock in the morning because they're open and I don't have to make an appointment. That's not acceptable. Yes, you may have insurance, but you're going to cost your insurance company and cost society 10 to 20 times more than it should have spent for that care. There has to be responsibility for the individuals to use what they have wisely so that there'll be money available for those that do not have. Because this issue of accountability in healthcare, we have to be concerned about one another. I have to be a good steward for what is available to me so that funds and resources can be available for others. And I'll close by, I thought about today is the anniversary for, I guess it's the 40th anniversary for the first man to walk on the moon. And as I thought about that this morning and I heard the stories about it, and I said, you know, I bet that health care for astronauts is pretty good. It's pretty good. I actually went online. I love the internet because you can, in 2 minutes, you can most of the time find anything that you need. And I wanted to ask myself a question. I said, how good is the health care for an astronaut? How much information can NASA receive about an astronaut who is thousands and thousands of miles away? Because I can't get information on some of my citizens next door. I can't get any information sometimes. But if you're an astronaut on the moon, they have your electrocardiogram, they can tell your blood sugar, they can tell everything, your temperature. There's special devices, and I looked at them today and found them. They can monitor you hiccup twice, pass gas in space, and they'll monitor it here on Earth. But if a patient goes to the emergency department who was seen in the clinic today, they can't get information in the hospital about what happened to the person in the clinic. So then therefore, what does the emergency physician do? He says, you know what? You're presenting in front of me, you have hypertension, you have diabetes, I have to repeat what? All the tests that were done in the clinic today have to be repeated because the physicians in the hospital can't get access to work that was already done in the clinic that day. So we have a country that can monitor the vital signs and the heart rhythm of a guy or woman thousands and thousands and thousands and thousands of miles away and out of space. But we can't put a system in place to be able to help us get the information to provide care to individuals just across the street. Our system is broken, but I think we can fix it. And I think we have the administration in place in a national level, at the state level, and here in the county. I know our county executive, Jack Johnson, has been supportive of all the initiatives that we've done in the health department. He's been very supportive, and we're very appreciative of Mr. Johnson and the time that he's taken to come sit in lectures that I've given on infant mortality. And I'll close by this. I'm over my time, but I was giving a talk at the local management board one day about infant mortality. And Mr. Johnson came in, Pat may remember, he came in and sat down for an hour and a half and listened to me ramble on about infant mortality and what's needed in Prince George's County. And I respected him a great deal for that. I respected him because he put me in a job already, but I'm joking, I shouldn't say that. But I'm sorry, I shouldn't joke around about certain things. But I did. I saw in the county executive in that day to sit down in an hour-and-a-half lecture about infant mortality that he was truly concerned. And I didn't know it was coming. And when he walked in the door, I thought I might have been in trouble or something like that. But suffice to say that I think we have all of the tools in place and the people in place to make some tangible advances in the delivery of health care. In Prince George's County, we're fighting and working all the time for increasing our safety net, increasing the number of physicians, to look at getting maybe a teaching facility or some hospital in place that can provide the care to individuals in the county. We have so many facets of our healthcare system that need to be tweaked a little bit. But I think with that tweaking, with the constructive criticism that you provide, I think we'll be able to make it happen. Thank you very much.
Well done.
Well, we certainly want to thank Senator Cardin for his remarks and Dr. Schell for his. And one thing I'll say to Dr. Schell, you know, I don't buy men's suits or men's shoes often either, but I do buy women's suits and women's shoes, and it works out the same way. The only difference is, as a woman, we'll take them back. I want to take the opportunity to acknowledge Mr. Michael Herman, Chief of Staff to County Executive Johnson. Thank you, Mr. Herman. And I'd also like to acknowledge Mr. Mel Franklin, who is a member of the Board of Trustees here at Prince George's Community College. Thank you. And we also have joining us Senator Paul Pinsky. There you are. Good. And many of you have come in this evening and you've been greeted by members of the senator's staff, and they've asked you to fill out some blue cards. We're going to start the questioning this evening, and I'm going to read just a few of those cards, and then we're going to open up questions to the audience. For those of you tonight who may not get your question read, or you may not get to ask a question at the 2 microphones that we have available, please be assured that the senator's staff will review every question with him so that as he represents us, he'll understand what our issues and our concerns are. So I want you to bear with me, and all of you know what we're talking about tonight, right? Health care. Okay. The first question, Senator, for you is from R.E. Smith, who is from Fort Washington. And the question is, I am in receipt of federal health care insurance, Blue Cross, Blue Shield, and Medicare. How does this new health program affect my present coverage? I am satisfied with the current coverage that I have.
Now, I'm going to answer that question, but first, Dr. Schell, would you stand up for 1 minute? The suit looks like it fits him pretty well, don't you? I mean, that was a good analogy. I just want to, and I also want to acknowledge Carlton Atkinson's here, who represents me in Prince George's County, so that you know that Carlton is here and someone you can see. If you're satisfied with your current health insurance, there's not going to be anything done that will affect that. Now, the Federal Employees Health Benefit Plan is a plan in which you have choice. You have choice of whether you want to be in a preferred provider network or in an HMO. You have different types of options, different types of costs, and you make your choice as to what you plan is best for you. We do tailor it a little bit. We do. It may not be a full fitted suit, but it's at least an option that allows you to pick what's best for you. You'll be able to continue in that plan without change. There will be no change. And that would be true also if you have a plan at your employer that is working well for you, that's been negotiated, or you're satisfied. There would be nothing in this plan that would require you to change your plan. You can keep the plan that you have.
Thank you. The second question is from Sandra, who's from Largo, Maryland. Under essential benefits, oral health for older adults, for older persons and adults is missing. This is critical. And how will this be managed under health care reform, dental care, oral healthy care?
Right. I've actually filed legislation to provide oral health care within our health care system. Senator Bigeman has also been involved in this issue. We think it should be part of the preventive health care package. Oral health care is relatively inexpensive, but the failure to take care of your oral health can be extremely expensive, can